An 11th person in the United States has died from the coronavirus. 10 of those deaths have been in Washington state. And tomorrow, Vice President Pence heads to Washington to meet with Governor Jay Inslee. NBC's Steve Patterson is in Seattle with more on the outbreak there. And Steve, what are you hearing from Washington health officials today? What can you tell us about the status of the outbreak there?
Well, first things first, Allison, I want to tell you about what's happening right now. The University of Washington, their medicine department, they have developed their own independent testing. There's a press conference going on right now announcing that. We've done some reporting on it previously, but now they are telling the public about it. This is important because it is supposed to be faster, more efficient. It's approved by the CDC. It follows WHO guidelines. It follows FDA guidelines. And basically what they can do is bring in more samples to people here locally. That is huge for the anxiety that is in this town and surrounding areas. They think that they can test about 1,000 samples at a lab that will be open 24 hours a day, 7 days a week. Great news for people here who want to know more about whether or not, frankly, they have coronavirus. Is this, the allergies? Is this the flu? Or do I have something that I could spread to my uncle who already has respiratory issues? That's a huge concern for people who are on the ground here dealing with this in what is right now known as the epicenter of this virus. As far as what we're going to learn more about the wider ramifications of what's happening, we've just heard that there is now a press conference scheduled in about a half hour or so with King County, with public health officials. We may learn more about what's going on and as far as how they're responding to it. They've already released the numbers part way of the day, though, earlier. There were 9 deaths yesterday. There are now 10 deaths. There were 27 confirmed cases yesterday. There are now 39. So it speaks to the fact that this is a steadily growing virus, and we have not seen it slow down since it started, obviously. There are, health officials say that they're doing everything they can to stop the contain of it, but it seems to be growing at a number in which we don't know how many cases are really out there. That is why there's all this anxiety here in Seattle and the larger surrounding area, Allison.
Steve, Amazon confirmed that an employee in one of its Seattle offices tested positive. What do we know about how the company's handling that?
So we're standing outside of that office right now. I can tell you Amazon has sent word to its employees. This is one employee who fell down sick, I think February 25th, left work feeling sick, was confirmed positive for the coronavirus, did not return to work. And so it's told its employees that have had close contact with that employee, basically alerting them to the situation. We've been watching this building all day long. People are coming in and outside. It appears to be business as usual. Yeah. But obviously, Amazon employs a large amount of people in this area, close to 55,000 workers. That's a very large footprint for this area and obviously the people that live in the surrounding areas. And so that's just more anxiety, Allison. Are
you seeing any of that from other parts of town? I mean, we know there are other tech companies in the area. They're also urging employees to work from home or not travel so much. Are you seeing kind of in the day-to-day there that there are fewer people around, residents a little more on edge, aside from just over by Amazon?
It's out of an abundance of caution that tech companies in town and surrounding areas are saying, if you don't have to be at work, you might as well not come to work. Yeah. I can't tell you personally what the day-to-day is like in Seattle. I've only been here a few hours, to be honest with you. There are reports that it's a ghost town, that businesses are shuttering. I can't see any example of that just walking around on the street.
Things are open there.
But to say it's necessarily... Things are open, but to say that it's entirely business as usual, you can see the look in people's eyes. It's kind of like this fight or flight look that people have when you're just walking down the street. You've seen people wearing masks. You've seen people with the N95s. It's not prevalent, but it's happening. I think people are just generally worried about catching the virus, about spreading it. This is something you can't see it, you can't taste it, you don't know who has it. And so it's troubling for people, I think, going into especially an office environment where there are people in close quarters, in close proximity, people are worried. Yeah. And so certainly you've seen that on the streets of Seattle and the surrounding areas. I was in Kirkland, where that life care facility is. Yeah. There is an abundance of anxiety around that area, of course, because most of the deaths, most of the cases have emanated from that area. So yes, I mean, there's an extreme amount of anxiety, but people are continuing their day-to-day, of course.
Sure, Steve, I'm sure when they see those masks, people wearing them on the streets, when they see the news crew show up, they're probably not entirely thrilled because they know we go where the incidents are, where the cases are, and that's got to be alarming. I know you mentioned the new testing. Are there other ways hospitals there are prepared for this in case it does get worse?
You know, I visited Kaiser Permanente in Oakland. They had an entire wing of their hospital, 10 beds, that were completely empty. It was very eerie to go down there. There were no patients. There were no hospital officials, no staff. It was literally dark. They flip on the lights, and they showed me room to room that they have rooms available that are both isolation rooms, which means they use a different ventilation system able to stop the spread of something that is airborne or droplet-based. They said that they have staff ready to go. They showed me an equipment room with those N95 masks, with equipment ready to go as well. I can't speak to every hospital and the equipment they have available, but I think if you're talking about something that is like the flu of 1918, if you're talking about a movie-style outbreak, I think health officials would be honest and say they're not prepared for something of that scale, just based on the equipment alone. The World Health Organization said there's already a crisis for those protective masks. People are panic buying those masks as we speak. Health officials, hospitals need those. Respirators, the amount of work and staff it takes to operate just one respirator, let alone a whole hospital floor of them, would take a lot. But I think if the virus is that steadily spreading and the word of advice is to tell people to stay at home and self-quarantine, I think hospitals can manage the overflow of that. People that are already very sick, the elderly, people that have respiratory issues. I think hospitals are prepared to handle that, and they're gearing up and staffing up and alerting the public to do that. Allison.
Steve Patterson, thank you so much for giving us a sense of how things are there on the ground in Seattle. Appreciate it.
Yeah.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.